Welcome back to Close Up. She got the top job at New Hampshire's Health and Human Services just 2 months ago, and in that short time, she's had to contend with the rapidly multiplying problems presented by this pandemic. Commissioner Lori Shibinette joins us this morning. Thank you, Commissioner, for being here.
Thank you.
Heck of a way to start a new job,
yes,
but you're in it now. So this is all very bleak. So let's give people a chance to look at what they can do. What are some of the volunteer opportunities being offered by the state right now for people to help in this pandemic?
Adam, NHResponds.org, just an amazing opportunity for all of those healthcare professionals that are very mission driven. That's what we rely on. You know, all of our retired nurses, retired doctors, or healthcare professionals that have gone into administrative roles that may be furloughed right now and are looking for an opportunity to help. Not every volunteer position is right on the front line of taking care of patients with COVID. Although we need those people, there are other things. You know, for an example, our public health department is inundated right now with the number of people that we are following, monitoring. You know, every positive COVID patient is a call every single day from a public health nurse. So if there are folks, you know, within our communities that can come out and even volunteer in our public health department, if they can't get to the front lines, we'll take all the help we can get.
They're screening, though. Essentially, you guys aren't going to want people who are in the high-risk group to be doing too much out and about stuff, right?
No, you know, and we've said that before, that, you know, every member of our community has the opportunity to volunteer, and that, you know, you have to look at what you're capable of. That could look like just doing Skype visits with an elderly neighbor, or dropping off food at their door so that they don't have to go to the grocery store and things like that. But I think everybody has the opportunity to rise up and really help their communities.
How about non-medical volunteers? The call went out for that too. What are you looking for those people to do?
We need everything from transportation professionals to IT professionals. You know, all of these new programs that we're standing up, our alternate care sites, they all need that functionality of transporting patients back and forth, the logistics, the food service, all of those things. So really, any area of healthcare that you touch, we need right now.
Let's talk about the clinical surge areas, standing up in Manchester, Nashua as well. Do you think you're going to need all 8 locations that you're planning for? And what's going to go on there, essentially?
We really hope that we don't need them. The goal is to plan and to be ready, but never occupy them. You know, we're looking at there's so many models right now, so we're looking at the numbers, and we're hoping that between the internal surge, because we're not talking a lot about that, the hospitals can do an internal surge, or at least some of our hospitals, where they may have wings they can convert to med-surg beds or critical care beds. So we have internal surge and external surge, which is SNHU that we saw just this week. So between those two types of surge, we're hoping to be between 1,700 and 1,900 beds that we stand up in the state of New Hampshire.
Can you tell us where the other external surge locations are going to be, or is that just sort of an as-needed basis? Well,
you know, right now we have 3 teams of people, and we have almost like a recon team that is looking at all the different sites. Do they have accessible bathrooms? Do they have privacy? Do they have the square footage to set up 100 beds? So we have recon teams going all throughout the state. So I can tell you, we know that the Manchester location, we know that Nashua High School is being set. We are fairly certain that we have a Durham location that is being set. And I think that you can be fairly certain that we're looking at a lot of our college systems across the state, because they often have those big auditoriums that we can use.
Your background is in nursing homes, administration there.
Yes.
And that's a big concern moving forward with this, certainly what we saw in Seattle with the mortality rates that can affect the seniors. What's the plan from the HHS perspective in terms of if we do see an outbreak at a nursing home in New Hampshire?
Let me start by saying I am so proud of this group of providers. We hit the ground running with our long-term care providers from day one, and had webinars and conference calls with all the nursing homes and all the assisted livings in the state. And they took some very, very aggressive active measures right from the get-go. So if you walked into a nursing home today, which you wouldn't be able to unless you were an essential
theoretically walked in.
If you theoretically walked in, even if you're an employee of that nursing home, you're going to get your temperature taken. You're going to be asked all the active screening. If you have a loved one in a nursing home, Most nursing homes in the state has set up Skype right now. A lot of the nursing homes in the state has set up a cohort of rooms so that if they do end up with a positive patient, that they can separate and make sure that that person gets the right care without transmitting to other patients in the facility. So this group of providers have really done an unbelievable job in preparing for this, and we're very proud to be their partner in doing that. We had public health on the phone with them right from day one.
When it comes to the testing process, how is the state now monitoring all of these different organizations that are conducting testing? Is it all just incoming to you guys? How do you ensure what's being done is correct, essentially?
Sure. So all of the positive testing is coming into the Division of Public Health, and that's really important because we need to be able to identify patterns and cohorts of outbreaks and things like that. So we have public health nurses, 2 shifts of them, dozens of people that make contact with organizations, individual patients, close contacts in the family every single day. So we are watching how this virus is transmitting through our communities.
In terms of testing, is it safe to say we're going to need a massive increase in capability to be able to get off of these measures that we're taking, the governor's taking essentially, stay at home, things like that?
Sure.
Isn't testing going to unlock the door to those things, essentially?
I don't know if it's an unlocking of the door, but it's definitely a change in strategy. So, you know, we are doing an aggressive job with testing. I think we are number 8 in the country right now per capita of the number of people we are testing. I think right now, because of the supply shortages, and it's not just testing supplies, it's PPE, it's specimen collections, it's almost everything. Our strategy is around making sure that we have a diagnosis for those people that are in the hospital, healthcare workers that are on the front lines that need to get testing done right away. As our supplies increase, our strategy is going to shift, and we're going to shift more towards how can we learn more about this virus? How can we learn more about how it's being transmitted, and how can we prevent further cases in the future? And I'm hopeful that that time is going to come in the next couple of weeks, that our testing supplies is not going to be such a limiting factor for us.
All right, Commissioner Laurie Shibinette, we're out of time for now. We'd love to have you back in a few weeks as we continue to go through this. We appreciate your time and your efforts.
Thank you.